Hello, everybody, and thanks again for joining our Laporte Medical Podcast. Today is a very special day as we have the honor to welcome Dr. Fatima Cardoso as our guest speaker. As everybody know, Dr. Cardoso is a well-renowned oncologist from Portugal, and it's such an honor to have you today, Doctor. How are you?
Hello, nice to see you and see everybody, and thank you very much for the invitation.
Thank you, Doctor. So yeah, maybe just let's begin with just telling us a little bit about yourself.
So I'm located in Lisbon, Portugal. I'm a medical oncologist, an expert in breast cancer, and I've dedicated almost my entire career to breast cancer. Although I've started also by taking care of other women's cancers. And then in these last couple of decades, I've dedicated most of my work to advanced breast cancer and created the Advanced Breast Cancer Global Alliance, of which I am the current president.
Fantastic. And so, Dr. Fatima, tell us a little bit what really brought you to become an oncologist, or what inspired you, and especially choosing, the path for breast cancer.
So as far as I remember, I always wanted to be a doctor. I had some doubts when I was choosing my university if I would go to veterinarian, but I remained to be a person's doctor. And when I went to medical school, I actually wanted to be a pediatrician.
Okay.
But a lot happens when we go to university and we learn a lot more about the different areas of medicine.
Yeah.
And I discovered the biology of cancer and kind of fell in love with the biology of cancer, wanted to know more. And when I was finishing medical school and I had to choose my residency, one of my best friends had breast cancer. And so that was the final, let's say, argument for me to finally choose oncology and to always wanted from very early on to focus on breast cancer. Another area that I really enjoyed was infectious diseases. So I would have gone to either oncology or infectious diseases.
Oh, that's amazing. And yeah, you were telling me before that you were actually born in Africa.
Yes, I was born in Africa, in Mozambique, a country that was part of Portugal when I was born. And then with the independence, I've moved to Portugal. But, part of me and my heart is always very open to what is happening in low middle income countries regarding health in general, but cancer in particular, of course.
Of course. And I assume that, I mean, with all this international background that you have and combined with your medical expertise, probably brought you to this amazing foundation. I don't know if it's a foundation, no? The Advanced Breast Cancer Global Alliance. So tell us a little bit about that.
So it's not a foundation, it's an organization.
Okay.
A sort of federation because the members are also organizations. They are not individuals. So
Okay.
currently we have more than 270 organizations in more than 100 countries around the world.
Yeah.
And this work has started in the about 20 years ago, in the beginning of the 2000s. There were two very touching and very important surveys that were published, dedicated to, at that time, was only women living with advanced breast cancer. Not to forget, men have breast cancer and advanced breast cancer as well. But those surveys were performed in many different countries around the world. and they are still available online if people would like to see them. They were called the Silent Voices and the Bridge Survey. And
Okay.
what they showed, and some of the countries were in Latin America, for example. And what they have shown is that this group of patients felt totally abandoned. They felt abandoned by the physicians, the researchers, the policymakers, the
Yeah.
politicians,
Yeah.
and even also from the
Yeah.
patient groups, because the patient groups were very focused
Yeah.
on early detection and screening, and they kind of forgot this group of patients. So, of course, the message that early detection and screening is fundamental, we totally agree with that. But there is a group of patients that even if they are diagnosed early and they receive the best available treatment, they will still have a relapse and they
Yeah.
will have metastatic disease. And there was nothing for those patients. And so I decided I wanted to do something about it, but it was a huge problem, right? And so when we look at early breast cancer and we see what made the biggest advances in the
Yeah.
field of early breast cancer was, on one hand, early detection and screening, but also together with education and awareness, and at the same time, treatment according to guidelines,
Right.
using the new available treatments, but also using multidisciplinary care. And so what we tried to do was to extrapolate that for the metastatic setting. And we started this as a small working group within the European School of Oncology. And we started to issue some recommendations on how to treat metastatic disease. At that time, there was nothing good on guidelines for metastatic disease. And because it was an incurable situation,
Yeah.
people thought that they could do whatever they wanted. So as their experience told them, and we wanted to change that so that the treatment would be evidence-based. And that has grown, that working group has grown, and we have found that there was a huge need among all the stakeholders in the community.
Yes.
And that has led to the creation of the Advanced Breast Cancer Conference and guidelines, consensus guidelines. And the first one occurred in Lisbon in 2011.
Okay.
And we are going to have the 8th one this year in November, so it happens every 2 years. And
Okay.
the creation of these guidelines and then the dissemination around the world and the use of these guidelines as a baseline to develop also local and regional and national ones had a major impact on how we treat and also how we develop research for this group of patients. So the movement around the conference started to grow, and patients, as a very important point, patients are peers in this conference. They are not just, there every one or two. They are really coming to the conference and they have the same seat at the table as healthcare providers.
Okay.
And so all together we create the guidelines. And so the movement was really important around the conference, and they pushed me to create an organization that could fight for the rights of these patients throughout the world. And that's how in 2016 the Global Alliance was created.
Amazing. That's fantastic. As you know, Doctor, the majority of our academic activities for La Corte Medical are in Latin America. And yes, probably many of the patients there come already with a metastatic, a situation or, stage 3, stage 4. So, um, so the global, the alliance is also focusing in Latin America. Do you do
Yes, we have
some
many
activities there?
members.
Yeah.
We have many members in Latin America,
Yeah.
including also in our we have always had representatives of Latin America in our board of directors.
Mm-hmm.
And to explain a little bit better to those who are listening,
Yeah.
the Alliance is a sort of see it as a platform
Mm-hmm.
where the different types of stakeholders can
Mm-hmm.
be together. So what do I mean by that is
Mm-hmm.
we our members are either patient organizations
Mm-hmm.
or healthcare professional organizations
Mm-hmm.
or um, uh, policymakers.
Mm-hmm.
We don't have, unfortunately, those who actually take the decisions, like the regulators and the politicians. They haven't been able to join us, but we certainly work together to bring the
Mm-hmm.
needs to them, but
Yeah.
also companies, either pharmaceutical companies or diagnostic companies,
Mm-hmm.
and everyone who
Mm-hmm.
really, and when I say healthcare professionals, is not just physicians, but also nurses,
Mm-hmm.
psychologists. So
Yeah.
everyone wants to make a difference for these patients
Yeah.
because we look at the problems with a different perspective,
Yeah.
but all together we can build the solutions.
Mm-hmm.
And in terms of our activities, one of the biggest activities is writing of the guidelines, and
Mm-hmm.
then have, for example, regional applications, because you can have
Yeah.
excellent guidelines, but if you don't have access to the treatments, you
Mm-hmm.
cannot implement the guidelines.
Exactly. Yeah.
And one of the regions where we've been working for many years on doing this adaptation is Latin America. So, led by our colleagues in Peru, after we have an ABC conference in Lisbon,
Mm-hmm.
we
Mm-hmm.
have also a consensus panel with
Mm-hmm.
several experts from different countries in Latin
Yeah.
America, and we adapt the guidelines to the reality and the
Yeah.
resources available
Mm-hmm.
in Latin America. And we do the same for other regions of the world. And our activities are very different. They span from creation of the guidelines,
Mm-hmm.
some education and some awareness, but a lot of it and more, we are focusing on policy and the needs on how to change some laws, how to give more protection, how to give more financial coverage to
Right.
these patients, and
Mm-hmm.
how to fight inequalities. I am sure you are very much aware that
Yeah.
these inequalities are increasing, they are not decreasing.
Yeah.
In this last decade, things have become more difficult, not easier,
Yeah.
and not just between countries, even within each country.
Mm-hmm.
For example, myself as a physician, I sometimes have to treat patients differently according to what they can afford.
Yeah.
And
Yeah.
I'm sure that many of my colleagues listening to me have felt the same. And
Mm-hmm.
that is terribly painful for us as well.
Mm-hmm.
But of course, it's even more painful for patients, right?
Yeah.
That you know there is a treatment, but you cannot receive
You can
it,
have access to it. Yeah.
right?
No, no, no. I completely agree. And yeah, we do have a line of events that we do in Latin America that they're called Cáncer en la Mujer. So um, it's not, I mean, when people hear about Cáncer en la Mujer, they are thinking only on breast cancer actually, but it actually goes around all the different pathologies or oncology
Mhm.
pathologies that can affect women. So lung, breast, gynecology, everything. And it will be amazing to have you in every event, to be honest, and talk about these global alliances because it's exactly what we try to express to all the people that attend the event, and they are quite multidisciplinary, as you're saying. So we have nurses and all the different specialities. We do not receive patients, I have to say. I mean, we do have different workshops sometimes in different events. But I think this is something that is so needed in Latin America, an organization like this, because I mean, it can focus so we work with different breast cancer societies in all the different countries, and we try to give them um, a door, a platform to talk about, and it's just changes so much, doctor, from country to country. All the,
Yeah.
what the patients have access to, and how the reality and who are the decision makers, everything. So yeah, we for sure need to showcase this a little more.
And also, don't forget to involve the patient
Yeah.
advocates and the
Mm-hmm.
patients, because of sometimes the physicians have one perspective, but there are also other obstacles, other difficulties
Yeah.
that make the best treatment not available for patients. And
Mm-hmm.
when I'm saying that, it's not just expensive medicines, where there are many problems
Mm-hmm.
surrounding the cancer in general,
Yeah.
breast cancer in particular, and
Mm-hmm.
metastatic breast cancer as well. But even from a good diagnosis, so
Yeah.
access to good pathology, to good
Mm-hmm.
imaging, so you can
Mm-hmm.
have a proper diagnosis, because
Yeah.
we have been able to change the survival of breast cancer by treating according to subtype. So
Yeah.
different subtypes have different treatments. But for that, you need to have a good pathology report. And that
Exactly.
is a hurdle in many countries.
Mm-hmm.
In other countries, it's the referral system. So from the time a
Yeah.
patient a symptom until she or he have a diagnosis, there is a long time going between the
Yeah.
two. And that means that most cancers are diagnosed in advanced stages.
Yeah.
And if we can shorten that, that would be really fundamental to improve the survival.
Mm-hmm.
And that's why the work that the Alliance does, we don't do it isolated.
Mm-hmm.
We are partners with the World Health Organization, WHO, and you
Mm-hmm.
know that WHO has a global breast cancer initiative. It
Yeah.
also has a global cervical cancer initiative
Mm-hmm.
and a global pediatric cancer initiative. Why? And they want all to be together. Why? Because usually the mothers take the kids to the doctor, right? And
Mm-hmm.
if you have a woman and the children with her, you should take the opportunity to look for all the cancers that can
Yeah.
affect the women. And in low middle income countries, cervical cancer is still a big problem.
Yeah. Mm-hmm.
And so the our goal as an alliance is to call the attention for all the different important steps that we do in cancer, that we do
Mm-hmm.
not forget those that have metastatic disease. So one of the things we have done was to altogether decide on 10 goals, 10 objectives that could be achievable,
Mm-hmm.
not a dream, but something that we
Something more
could achieve.
tangible. Yeah. Mm-hmm.
Yes, and measurable. And
Mm-hmm.
we have done that work in 2015, and we defined this, and we call it our ABC Global Charter.
Mm-hmm.
There's 10 goals for a decade.
Yeah.
And the decade is now coming to an end, 2025.
Mm-hmm.
So this year at the ABC conference, we are going to present a report that looks at these 10 years, what has happened in the field of metastatic breast cancer.
Yeah.
For each goal, have we achieved the goal or have we not achieved only in a few countries, only for a few patients, or what has happened
Mm-hmm.
in these years? And based on that global report, we are writing the next charter, the next goals for the
Right.
next decade. This global charter is really an important tool, and it has been translated for almost 20 languages. One of the
Okay.
first was Spanish, One of the first was done by our members in Latin America.
Yeah.
And it can be used as a lobbying tool. So you can go to your politicians in your country and say, these are the most important needs of metastatic breast cancer patients. This is what we need to achieve.
Yeah. Mm-hmm. No, that's amazing. I think that, as years go by, we kind of realize how important it is to include these topics within the events. As all the events have, all these amazing new treatments and new drugs and the latest technology, but they don't focus too much in the reality, let's say, of each of these countries. And the reality is that maybe 80% of the patients cannot access,
Yes.
the
And
treatment.
for
So,
example,
yeah,
when we discussed in the last set of guidelines for ABC 6 and 7,
yeah,
the majority of new treatments that appear these last 3-4 years, they can only be valuable perhaps for about 10-15%
exactly.
of the, and the vast majority of patients will never have access to them. Why? Because, well, they are extremely expensive. They are also targeted, and they need us to find the target. They need the test to be made so that it can, you have to have the target so the
Yeah.
targeted therapy works. And that test, the diagnostic test, is sometimes totally out of pocket. Even in Europe, in many countries, you
Yeah.
sometimes have the drug, but you don't, the test is out of pocket, it has to be paid by the patient. And the cost of the test is so high that the patient cannot afford. And so one of the fights that we have to continue moving forward is, okay, if you are, as a government, if you are going to approve a new treatment, and that treatment needs a new diagnostic test,
Yeah.
you have to approve both. Because if it's like, think about the most important advance in breast cancer, which was the anti-HER2 therapy or trastuzumab,
Yeah.
right? That is a targeted agent, but you need to have the HER2 testing, because if you don't have the testing,
Yeah.
you don't know if you can use
Yeah.
the new treatment. And so we have to all speak the same language and ask for the same things, so that at least if we keep on pushing, they will have to pay attention and change the laws.
That's amazing. And I agree with you 100%. And as I said before, that's what we're trying to do. We're trying to incorporate more lectures of how to improve this access for everybody. Because, I mean, it kind of changes from country to country in Latin America. I mean, some countries are starting to offer, better national insurance, let's say, or health insurance to everybody. But the discrepancy, it's huge. It's,
Yeah.
as you say, I mean, it could be 80-20 or 90-10 or something like that. So yeah, I think it will be amazing to probably, have you um doing some lectures and trying to see how we can involve everybody in, especially the decision makers, and we do from time to time in the event, so that would be amazing. So yeah, I wanted to talk to you also about, maybe all those new drugs and new treatments and new technologies, but I think we are probably running out of time. Maybe we can do another podcast, and because I love that we focus this one in this that is so important to all these developing countries in Latin America. And so if somebody after listening to this podcast want to get in contact with you, what do you suggest?
So if someone is interested in the work of the Alliance, you can go on the website and look for Advanced Breast Cancer Global Alliance, and you will have the description of all the different types of activities that we
Yeah.
have. And one good thing is that our website has a software that translates everything into more than 100 languages. And so you can listen to all of it in Spanish or any
Yeah.
other language that you prefer. If you want to become a member, just remember that it's an organization who needs to become a member, not just
Yeah.
an individual.
Okay.
And we already have, and you can find listed in the website as well, all our member organizations from Latin America, but we are always open to have more.
Yeah.
And the guidelines, the ABC 6 and 7 guidelines are out. It is open access, so everybody can have access to the manuscript. And not so long ago, the the manuscript adapting the ABC5 guidelines in Latin America was also published last year, I believe. And so look for those manuscripts, and you can already have good tools for your clinical practice. Apart from that, I'm always available by email. I do have a little bit of delayed reply because I receive many emails, but and you can also look me up in LinkedIn, and I'll be very happy to help. And I'm always finding new friends from Latin America in the different conferences. So I'll be happy to meet anyone who wants to meet me in one of the next conferences.
Amazing. And what would be that special message you would like to send today to everybody who is, I mean, your colleagues in Latam?
Well, I think that the most important message is for each of you, never give up. So I know how hard it is to practice in countries where you go to conferences, you listen to the
Yeah.
new things, and then you go back home and you cannot give them to your patients. I understand that difficulty, and also the the pain it is to not being able to give the best available treatment to the patient in front of you. But think that even without the new expensive therapies, we can provide very good care to the patients, both with early and metastatic disease. And please also listen to your patient. The patients have different priorities. Okay. And this is important in any setting, but in a setting where the disease is incurable and you have different options of treatment, discuss the side effects with the patient. Because for some patients, some side effects are more important than others. No, I always
Yeah.
give the example. If you are a surgeon and you have breast cancer and you need to be treated, you don't want to have neuropathy, because if you have neuropathy, you lose the functioning of your hands,
Yeah.
right? So, but if you, for example, you have a more a work where you are in front of a public, maybe losing your hair is something that you do not want. So listen to your patient and what are the priorities of the patient, and decide together what is the best available option.
Yeah, that's so lovely. And I do think that, I mean, they are everybody in Latin America, they do make us a huge effort, believe me, to, to do the best they can. And as you say, try to adapt and see every patient as an individual, right? Which is probably the most important thing. So with this, thank you so much, Dr. Fatima. There are so many things that I would love to ask you, but I know you're so busy, and we'll keep in touch for sure.
Yeah.
And yeah, thank you so much. And it's congratulations on all, your achievements that are amazing
Thank
and
you very
helping
much.
so many people. Thank you.
Thank you. Thank you.